The scary part about these cases are that it's a bacteria that is pretty common but develops resistance to most of the antibiotics that we have.
Dr. Andrew Fishman is referring to a potent bacterium called carbapenem-resistant Klebsiella pneumoniae, CRKP for short. That's infected over 350 mostly elderly patients in California between June and December of 2010. 40% of these patients died within a month of becoming infected. The germ in this case is resistant not only to the antibiotic carbapenem but to all other available antimicrobial drugs. This strain of superbug has been reported in 35 states in the United States, but it's also caused infections in Argentina and Brazil, 15 of them fatal. And it's just one of a growing number of dangerous bacteria that are proving resistant to mankind's arsenal of antibiotic drugs. The effectiveness of that arsenal, medical experts say, is dwindling fast because of widespread use and misuse of antibiotics.
Antimicrobial resistance is increasing worldwide, not only for a specific antibiotic, but for every antibiotic in every disease, for not only for humans, but also antibiotics used in animals also. When you talk about TB, malaria, HIV, but also diseases like pneumonia, they are real diseases, there is antimicrobial resistance in all across the spectrum.
Dr. Marcos Espinal, who manages health surveillance, disease prevention and control at WHO, is heading up a campaign to educate patients, practitioners and the general public about the spread of antimicrobial resistance in the Americas. Underscoring the seriousness of the problem not just in the Americas but around the globe, the World Health Organization has made antimicrobial resistance the theme of this year's World Health Day observance on April 7th. The WHO wants the international community to step up efforts to identify and combat these dangerous new superbugs. The message is alarming. Even the most powerful antibiotics may fail against these superbug strains. Hospitals are the most common breeding grounds of superbugs, but they can spread quickly within community settings as well. Dr. Espinal says many a times infections go undetected because more sophisticated techniques are needed to detect these potentially deadly superbugs.
Sometimes they are happening and we're not detecting them. There is always the under-reporting issue that is very common in resource-limited countries. That is, they don't have all the necessary tools and type of laboratories required to do that.
In today's interconnected world, with millions of travelers jetting every day to all corners of the globe, bacteria can be spread faster than ever. Public health experts are calling for stricter disease surveillance, better patient monitoring systems, and the establishment of special committees in hospitals to enforce more rigorous hygiene and sanitation standards. Doctors advise that frequent hand washing, patient isolation rooms, and more selective use of antibiotics can help stop the spread of superbugs. Experts agree that the world needs a new class of antibiotics to beat the superbugs down, but they warn that doctors and patients must learn to use these new weapons more carefully.
Developing new antibiotics will also require developing of new microbiological techniques to detect antimicrobial resistance to those new antibiotics. So it's a multi-purpose initiative.
WHO calls the growing incidence of superbug infections a major burden on society that's causing death, suffering, disability, and higher healthcare costs, a major challenge the medical community must face without delay. Vidushi Sinha, VOA News, Washington.